presentation on the roles and responsibilities of healthcare professionals. Topics covered within this presentation will include recent changes and their impact on the roles and responsibilities of the clinical psychologist, how professional bodies regulate the healthcare sector and its professionals, and an evaluation of the effectiveness of the multidisciplinary approach within a healthcare setting. So what does a clinical psychologist do? A clinical psychologist will have a minimum of one bachelor's degree in the field of psychology. They may have further qualifications such as a master's degree or even a doctorate. A clinical psychologist will typically work within a setting such as a hospital or outpatient clinic, treating a variety of ages and conditions, but can also be found working in areas such as forensic investigation or education. Areas of work include that of addiction, forensics, child psychology, learning disabilities, geriatric psychology, and neurological disorders or trauma. They may work within the public, private, or freelance sector throughout their career. Alongside their day-to-day specialty of diagnosing and treating specific mental health conditions such as anxiety disorders, eating disorders, and mood disorders, a psychologist may find themselves also operating as part of a multidisciplinary team. They may liaise with the community, friends or family members of patients and other professionals such as teachers, social workers and doctors. In special circumstances, a clinical psychologist may be involved as a consultant assisting in legal cases. Treatments used within this field include various forms of therapy, typically chosen specifically for each patient's personal needs. Popular treatments include cognitive behavioural therapy, dialectical behavioural therapy, and mindfulness. So here are some examples as well of jobs within the clinical psychology sector that I mentioned. So, what skills are needed to be an effective clinical psychologist? To work successfully within the field of psychology, it is extremely important to possess certain skills and personality traits. Excellent organisational and timekeeping skills will allow you to be prepared and on time for your clinical appointments with patients. Empathy and an open-minded personality can allow you to connect with patients to help understand their needs and feelings on a deeper level. You may have to deal with uncomfortable or potentially traumatic topics sometimes with patients, so being non-judgmental is key. Throughout your career, you will work independently and at times as part of a team. You may even find yourself within a teaching scenario, offering support and advice to schools, organisations, employers or family members. Confidence and an up-to-date education are very important. Being aware of your own professional and academic limitations can allow you to know when it is time to consult with another trained professional, ensuring your patient gets the right type of care required for their specific needs. These are just a few examples of crucial skills and traits that can allow a psychologist to work to the best of their capabilities. So you could be analytical, a people person, empathetic, flexible, a problem solver, and intuitive. So how has the COVID-19 pandemic affected this job role? The COVID-19 pandemic has had devastating effects on the quality and rollout of continued mental health care, as well as the general mental health of adults and children/young people within the UK. An NHS survey has found that numbers of mental health conditions being diagnosed in children and young adults have been rising since 2017, leading to a statistic on new sleep disorders affecting 54.1% of 11 to 16-year-olds and 59% of 17 to 22-year-olds during the pandemic lockdowns. A sample survey of over 200 UK academic and practitioner psychologists conducted by the British Psychological Society has found significant reasons as to why the profession has been affected by the pandemic. This includes changes to everyday work life for psychologists. The move to allow psychologists to work from home and avoid face-to-face contact with patients has been a huge change for the profession. Typically an in-person role with regular contact with patients, psychologists' workplaces are now also their homes. Increased anxiety over IT and phone communication with patients has become an issue, as well as worries surrounding client confidentiality and personal boundaries being breached due to problems such as remembering to call from a withheld number from a psychologist's home phone. Responsibilities of psychologists have grown. They are now expected to not only continue their regular work, but ensure they have sufficient setup at home. This includes IT equipment, internet access, and access to an enclosed workspace to allow privacy and personal responsibility in ensuring personal and professional boundaries are not breached. They have been expected to adapt and accept the new reality very quickly, despite many psychologists from this study admitting to experiencing new personal stress, anxiety, frustration, and confusion from the pandemic. Role progression may have been halted due to training conferences and workshops being put on hold or held over the computer. This is especially true for clinical psychology students, who have not been able to benefit from in-person placements and experiences at university. It is also important to note that some of the psychologists within this study found benefits from the pandemic affecting their roles, with more time available to spend at home and travel fees to and from the workplace reducing. However, you could argue their home electrical expenses may rise as a consequence from being home all day. So, recent changes to the profession outside of the COVID-19 pandemic. The NHS New Roles Task and Finish Group announced in 2019 that clinical psychologists, making up a significant sector of the psychological workforce, are now given the opportunity to request to become part of the non-medical approved clinician status workforce. This allows them to take on further responsibilities and powers relating to acting on and upholding the Mental Health Act, including being able to officially section at-risk patients for their own safety. Alongside this, the NHS has released a long-term plan, laying out their visions for changes to the psychological profession during the years of 2019 to 2024. Significant changes include, listed here, the encouragement of extra use of psychology across the entire healthcare sector, the encouragement of a more diverse workplace targeting new recruits, the acts of trying to cancel out inequality within the psychological healthcare sector, allowing more access for those in need in potentially lacking or poorer locations, and finally, encouragement towards a regular application of psychology in different areas of healthcare to assist in management of distress and reduction of illness. Finally, the 5-year forward view created by the NHS is aiming to employ a further 6,425 professionals within the field of psychology throughout 2016 to 2021, in a bid to help the rising mental health crisis. So, what do professional bodies within the UK do for healthcare workers? Here is a location of the HSE logo, a logo of the HSE logo rather, not location. The roles of professional bodies within the UK centre around safety and protection of workers and the public by enforcing certain standards. 3 highly regarded regulatory bodies include the Health and Safety Executive, existing alongside co-regulators within local authorities, as well as social settings. They work to regulate, standardise and ensure public safety by ensuring professional practice is carried out responsibly. They primarily investigate incidents relating to workplace injuries, sickness and accidents. They do not involve themselves in issues such as quality of care or poor clinical judgment. Accidents must meet their own stated criteria and be able to be reported under the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations of 2013. The HSE creates and distributes mandatory guidelines and criteria relating to current legislation and information. Next, we have the Care Quality Commission. The CQC have assumed some previous responsibilities of the HSE and work to ensure professionals are registered, regularly inspected and reviewed, providing public results and acting legally if required, which may include prosecution. They act as part of the Health and Social Care Act 2008 legislation, amongst other relevant regulations. Finally, we have the internationally regarded Medicines and Healthcare Products Regulatory Agency, ensuring safety and assuming responsibility of medical devices, blood transfusions, medication, education and supply. They work as an executive agency for the government's Department of Health and Social Care and regularly get involved with medical and scientific development with 2 subgroups, the Clinical Practice Research Data Link and the National Institute for Biological Standards and Control. So, professional bodies specifically for psychologists It is highly important that regulatory bodies, trade unions and organisations have specific options available to cater to the field of psychology. After all, you wouldn't want advice from an organisation specialising in dentistry offering you careers advice and guidance on clinical psychology. Professional bodies that offer services tailored towards psychologists include the Health and Care Professions Council, who also serve 14 other specialties alongside psychology. They are especially helpful in providing advice on indemnity insurance required by the government relating to the Healthcare and Associated Professions Order 2014. Psychologists must have indemnity insurance, either provided privately or through their employer, to join the HCPC. The HCPC are very active in promoting and upholding standards related to the education, training and professional practice of psychologists, and require the applicant to complete mandatory courses to join. Other prominent organisations for psychologists include the National Institute for Health and Clinical Excellence, the British Association for Behavioural and Cognitive Psychological Therapies, and the British Psychological Society. Services the BPS offers its members specifically include information on psychology-specific resources, codes of conduct, legal guidelines and policies, access to further education and training in the form of workshops and online courses, information on available trade unions essential in ensuring the psychologist can access representation and legal assistance if required, networking opportunities to meet fellow psychologists, and finally, opportunities for careers as well as informative information relating to careers within the field of psychology. So now moving on to the multidisciplinary approach within healthcare, specifically relating to psychology. So how effective is the multidisciplinary approach? The multidisciplinary approach is focused on combining the efforts of multiple different professionals and using each of their strengths in a specific way to improve patient care and treatment. This is incredibly effective as it allows a collaborative effort leading to potential breakthroughs in patient treatment and the availability of specific specialists to weigh in on certain topics. The patient will always be at the centre of a multidisciplinary team. So an example here in general healthcare would be a patient, a physiotherapist, a social worker, a psychotherapist, nurses and general practitioners. But an example team within the section of psychology may consist of a psychiatrist who specialises within physical and mental health and also diagnoses and has the ability to prescribe medication. A psychologist who is extensively educated on specific treatment options for certain mental illnesses and able to carry out that treatment and assessments. A mental health nurse who is experienced in carrying out care duties towards patients as well as administer medication. An occupational therapist who is able to provide rehabilitation and carry out assessments. A social worker providing support, advice and welfare duties towards the patient and their family. And finally, amongst these professionals there will also be a team leader. Topics discussed at multidisciplinary team meetings may include current patient welfare and health, future care plans and possibilities, the medical history of the patient, assigning tasks and goals to specific professionals, any issues raised within the team, important decisions regarding the patient. So, an evaluation of the multidisciplinary approach. Whilst the multidisciplinary approach has been applied to healthcare for a significant time period now, it comes with both its advantages and disadvantages to both patients and the professionals involved. Positive outcomes can include treatment plans and decisions are decided by multiple professionals, allowing for a wider scope of educated opinions rather than just one consultant. More hands on deck means more professionals available to access during your times of need, so you don't have to wait anymore for one consultant to be available. A created sense of partnership allows professionals to work to their strengths whilst knowing they are being supported by others. Practice guidelines and application become a natural and integral part of the team, allowing for better patient care as they are implemented regularly. Official inspections and auditing is made easier for professional bodies, as whole teams can be inspected instead of individual members, which takes up more time. And finally, the continuity of care and clinical management is much easier to establish. However, there can be negatives, including miscommunication occurring due to large amounts of team members, difficulty in organising meetings when every professional is available, If a team is not tight-knit and experienced in working together, this may create issues for the patient's treatment success, rate and efficiency of time. Dangerous mistakes occurring as a result of miscommunication, which could lead to severe injury or even death. Despite these concerns, the multidisciplinary approach has been shown to be an effective and successful way of managing patient caseloads and successful treatment. This has been found especially within UK cancer care by Friesig and others. In conclusion, I hope this presentation has provided an in-depth analysis and source of information regarding specific areas of the healthcare industry. Whilst I focused on psychology specifically, many of these approaches and stances apply to a variety of other healthcare scenarios. Thank you very much.